As we mark the World Breastfeeding Week 2014, it is important, friends, to renew political commitment at national and district level and increase investments in low-cost yet highly impactful interventions to improve nutrition, especially among women and children.
A well-breastfed child, you are getting rid of diarrheal diseases. We are protecting the child from pneumonia and other diseases. So there is no dispute. The importance of breastfeeding is so critical at an early stage. It is a responsibility not only of the mothers, critical as they may be, but of the fathers as well.
So what we are calling upon people, stakeholders, and our government is to say that let's cost this action plan that we have and implement it. It's very difficult to implement the recommendations of this plan because they're not costed, the structure is not in place. And so in 2014 or post 2015, our development program, we are calling upon all the duty bearers to put this into reality.
World Vision, you are doing good work in the field, please do more of it. But there is a rider. When World Vision is doing this work, please know that is the government of Uganda and the people of Uganda doing that work. The reason is very simple. World Vision mobilizes money and says, we are going to help Uganda. It comes here and agrees with the government of Uganda on priorities, on programs, and the Minister of Finance says, yes, this money can come for this purpose. Therefore, it is out of close collaboration that these good programs are actually going on.
Definitely, this comes with high level of accountability and transparency that we need at all levels of administration if all these things have to work well. In the next context of multi-stakeholder approach, all stakeholders must, or we actually ask and plead that some of these budgets that we have, let's include a line on nutrition. We need to move from just talking so that we can put things into action.
Employers in private sector, in most cases, do not implement the 60 days granted for mothers as stipulated under the Maternity Protection Convention of Employment Act of 2006. These all undermine a woman's confidence to breastfeed. Comrades from the Parliament of Uganda and other friends who are here, it is at this point that I urge all of us to support the relevant ministries of health and gender, labor and social development, as well as Uganda National Bureau of Standards, to enhance effective implementation, enforcement, and also monitoring of these instruments and other related interventions in order to be able to achieve the winning goal for a healthy and productive life.
As civil society organizations, we are key partners. As we have had, we work with communities, and with the kind of partnership that we have had with the government, you can see clearly that the communities are getting to be transformed. Even when we are saying that let's hear from ladies, for me I salute men that came from Kitugum, because we have been for a long time saying, where are the men? So let's celebrate the fact that a man can grab a microphone and speak fluently and articulate the issues of breastfeeding without the wife's input.
The people who market artificially made feeds are powerful in many ways, in marketing skills, in money, so their case overwhelms the good case of nurses. Nurses are overstretched They are few in number. They may not be as experts in marketing as these other guys. So, it's true they need to be reinforced. They are doing great work, they are doing commendable work, but the work will be too much for them. So, in a nutshell, let's be on the lookout. It is not that one that speaks loudest that necessarily has the best message for your baby.
We know, in particular, if I can draw from my own example, I know that when I was going to give birth to my firstborn, I got advice that I should really buy SMA. This is the milk thing. And they said, as soon as the baby lands like this, feed, because you don't have enough. These are the stories that keep on coming. And it's not that I'm not educated. But when you're in that situation, you accept every advice because you don't know. And so when we talk about awareness, when we talk about information, it's vital. It's until when a nurse found me trying to mix I can call it concoction, and he said, "Why do you stop?" I almost said, "But you never told me." I have just done it because I thought that's the best way, because at that time, you feel like you don't have the best milk. So let's put our efforts together, friends. Let's work together to promote, protect, and increase productivity that comes from good nutrition services.
The private sector and all employers should adhere to the regulations on marketing of infant and young child foods, should provide maternity and paternity entitlements to employees in accordance with the Employment Act of 2006. Create a working environment. Breastfeeding corner is what is recommended, that promotes optimal infant and young child feeding. And I'm told that Parliament of Uganda is a pioneer in this direction. And I commend this. Provide facilities and time for breastfeeding, expression of breast milk, and preparation of replacement feeds.
Breastfeeding comes from feeding well. We want to ask that we take serious measures to improve agricultural productivity with a specific emphasis on food availability and utilization for marginalized, most vulnerable groups like mothers and children.
I do appreciate the contribution of partners such as World Vision, UN agencies, development partners, and media for the support that they have given to this effort and to breastfeeding in general.